Why do chiropractors tell their patients to keep coming back if they're out of pain? Let's talk about that. This is a common question that I get when I'm talking to people in the Wichita community about chiropractic care, and it's an understandable question. A big reason why patients come to see us is that they are experiencing pain of some kind, and chiropractic care is very effective at getting people out of pain and getting them to feel better and function better. But it's important that we discuss why we have people come back even if they are not feeling pain. Pain is the alarm system of the body, and all that means is that pain is a way of your body communicating to your brain that something is wrong. Your body is trying to get the brain's attention. However, pain is a poor indicator of health, so the absence of pain doesn't necessarily mean that things are fine. People with cardiovascular disease usually don't experience chest pain until blockage in the arteries has reached a pretty significant level. People with cavities in their teeth usually don't experience tooth pain until that cavity is pretty significant. And we all have unfortunately heard of people who developed pain within the last month or two. They go to the doctor and they find out that they have an advanced stage of cancer. So while pain is a valuable alarm system in the body, the presence or the absence of pain is not necessarily a good indicator of our health. So let's come back to chiropractic care. Once we start care, it's common that our patients start feeling better relatively quickly, usually within a couple weeks. However, especially with long-standing issues, there is a need for continued treatment beyond pain relief because we need to address muscle imbalances and movement patterns of the body that may exist in order to provide a long-term solution to the problem. And even once we address those issues, most of the time what causes our patients' problems is the lifestyle that patient lives day in and day out. So once our patient has reached maximum improvement, we have to have a maintenance plan to avoid regression of the patient's condition. And this is applicable to anything in health. If you spend 6 months consistently going to the gym and then you decide to stop because you reached your goal, you're quickly going to lose all that progress that you've made. If you consistently eat well for 6 months and lose a bunch of weight and then you decide to go back to your old eating habits, you're going to quickly gain that weight right back. So a long-term solution to anything in the body requires an active plan to maintain the progress that has been made and avoid slipping back into old habits. So from a chiropractic standpoint, a long-term solution to a patient's problem requires a maintenance plan. This can include periodic in-office treatment, even if you're not feeling pain, a tailored home rehab program, and a commitment from the patient to some form of a regular fitness program to help them meet their goals and avoid regression. So to answer the question, we recommend people keep coming back even without pain because we know that without some plan going forward, that pain is inevitably going to come back at some point down the road. So with anything you do, always have a plan to maintain your progress once you reach your goals in your health and wellness journey. So I'm Dr. Mike Stanley with Stanley Chiropractic. Hopefully this clears things up about maintenance care, and thank you for spending time with me today.